As men age, they tend to have problems with their prostate. It can affect how they urinate, making it more difficult to go or more frequent to go. Prostate cancer is the most commonly diagnosed cancer among American men. So as men age, the incidence increases and can become more of a problem. That being said, in men of advanced age, they commonly have microscopic prostate cancer that's not clinically significant. So we're really looking for the men that have prostate cancers that could potentially harm them or affect their life. It's in several ways. First of all, it can be their symptoms. If you are having difficulties urinating, frequency of urination, weak stream, waking up at night to go, that can be a sign of benign enlargement of the prostate, which can affect your health in that area. You can also have prostate cancer, and unfortunately, with the early stages of prostate cancer, there really are no signs or symptoms. Most men are picked up using either a digital rectal examination, feeling the prostate with our finger in the examining office, or by a PSA, prostate-specific antigen blood test. That test, while controversial, has actually been shown to pick up prostate cancers earlier in the early stages of disease, allowing us to find men who have the disease and treat it early. So among urologists, we still feel that the PSA is a very useful test and really one of the best markers of prostate health that we have available to us. There are several groups that are at increased risk for prostate cancer. Again, as we get older, the disease is more commonly detected, so it's more common in older men than it is in younger men. African Americans have a significantly increased risk for prostate cancer and often have more aggressive disease at an earlier stage, so they're kind of a unique group that we look for. Also, men with a first-degree family member, father, brother, who have prostate cancer, they have twice the risk of the general population of having prostate cancer. And if you have a second-degree relative, a cousin or an uncle that has the disease, you have about a 1.5 increased risk of the disease. So those are people that we specifically look for. When we're screening for prostate cancer, and screening is where you have no symptoms or signs, but we're doing a test such as a PSA blood test to look for the disease, we tend to screen men between the ages of 55 and 69, because those are the men most likely to have a significant cancer that may cause them problems and a long enough life expectancy for that to turn into a problem if it's not detected. There are several treatment options for prostate cancer, ranging from active surveillance, which is where we carefully follow the person and not actually treat them, but delay treatment until either they begin to have symptoms or problems from the disease, or it looks like the disease has become more aggressive and we're concerned about it causing problems. And the idea behind that is that there is a group of men who may never require treatment for their prostate cancer and they die of other causes. There's radiation therapy, which can be delivered in various ways. External beam radiation therapy, high-dose rate brachytherapy. Those are delivered through the Arnold Palmer Pavilion and the UPMC Cancer Center that we are affiliated with. Also, there's surgery to treat prostate cancer. Typically, it's an operation called a radical prostatectomy, where the entire prostate gland and the tissues around the prostate are removed. That can be done either through a traditional open incision or robotically, which is a form of laparoscopic or minimally invasive surgery. More and more these days we're doing robotic surgery as it has shorter hospital times, quicker recoveries, less blood loss, shorter catheter times after the operation. Finally, in men who have advanced disease or recurrent disease, there are chemotherapies or hormonal therapies that either can be given in the urologist's office, or we also work in conjunction with our medical oncologists at the Hillman Cancer Center. I think we're very fortunate that here in Westmoreland County we have a partnership with the UPMC Hillman Cancer Institute at the Arnold Palmer Pavilion. There is a strong partnership between Excela Health, private practice urologists such as myself, and the physicians at the Hillman Cancer Institute to provide comprehensive cancer care for our prostate cancer patients.